I don't remember growing up hearing about heart attacks so often. People are dropping dead. Like just in the last 2 months, I've lost 2 distant cousins.
You see at least 2 to 3 heart attacks who are less than 35 years of age. The amount of exercise they do is almost zero. Being a male is risky because the commitment is not there.
A lot of women after menopause also are susceptible to heart disease, right?
Because now you're more prone to it. What is your drop rate of people who start exercise? It will be at least 50%. The most important cause of heart disease causing heart attack in young is.
I don't remember growing up hearing about heart attacks so often. Now it's just so often that people are dropping dead. Like just in the last 2 months, I've lost 2 distant cousins, all in the late 30s,
Right.
all to just heart attacks. Of course, bad lifestyle, not taking that away. Yes, like too much drinking, inactivity, of course, which also then means food habits are bad. But I just feel like it's happening so much sooner than it did maybe 2 decades ago.
Yeah, I mean, we see with at least once a week, and we are a busy hospital, by the way. We see at least 2 to 3 heart attacks who are less than 35 years of age.
Every
in
week.
the hospital every week.
This is every week.
Every week? Or, okay, I was scared.
I would say at least 2 to 3 patients who are less than 35 and either have suffered a heart attack or have had a need for an angiogram and they are found to have disease.
Yeah. So you've now been doing this, treating people with heart disease for, I believe, more than 3 decades. I'm sure you would have done thousands of surgeries and saved, multiple lives. Have you seen this change over the last 30 years?
Yes, very much so. So if you look at when we were students, and I'm talking about, say, early 90s, when we were doing our training for being a cardiologist, we didn't used to see patients less than 35 years of age for heart attack.
Yeah.
Very rarely. Now, I'll show you some example that a 35-year-old, 30-year-old guy who has, but if you look at them, I can tell from a distance that they're not good from inside the body.
Wow.
Because they all have central obesity. They all have visceral fat. They all have fat which is subparotid. So when you have subparotid fat, visceral fat, you are going to get fatty liver. You are going to get early enhanced atherosclerosis, which will lead to more heart disease, more strokes, and ultimately, diseases which come later in your blockages in your legs and wherever you want.
Wow.
The amount of exercise they do is almost zero. And of course, you add smoking to it, you add a lifestyle where you add food which is mostly rich in simple carbs. And that's the problem. See, 90% of our diet, even somebody say, I eat only, say, roti or chapati and rice. What else you eat? Don't eat. So your 90% of your calories are coming from carbs. And you eat minimum seven meals a day.
7 meals a day.
For example, you get up in the morning.
Oh yeah, you will look at it that way, yes.
You eat, you take a cup of coffee, there is sugar in it.
Yeah.
You take 2 biscuits. That's maida, sugar, first insulin spike at say 7:30 in the morning. Yeah. Then you add breakfast. What does it contain? Same upma, paratha. North Indians will eat paratha.
We will eat
Upma or some kind of idli, dosa. What it contains mostly? It's carbs, right? Some sambar in it, some chutney in it. That also probably carbs only. Where is the protein? None. So that is the 8:30, 9 o'clock breakfast. 10 o'clock, 11 o'clock, you will see again a cup of coffee, tea, because you're used to. That's got sugar in it.
Correct.
So that's the third meal. Then you have a lunch, which is again very, very carbohydrate rich. Then again, 5 o'clock, you have a cup of coffee, tea, biscuit, 1 samosa, 1 patties. What is it? Maida again, right? Come home, some snacking. and then the dinner,
and then late dinner.
and then the sweet, and you sleep late, and the dinner is actually very late. How many meals you had?
Yeah,
At least 6
easily
meals.
6 or 7,
Yeah.
Every meal is causing insulin spike.
Yeah.
What does insulin do? So I have a slide which I wanted to show. So this is the function of the insulin. If you look at the cell, see why we need insulin and glucose, because the glucose is your fuel for the cell, right? The glucose gives you energy, the protein gives you structure, the fat gives you shape. And of course, fat is like a insulating substance which gives you protection from cold, weather, and all kinds of things. But the shape comes from the fat. Protein is giving you the whole body structure. Everything is protein. But the energy of the cell, which is the glycolysis and the Krebs cycle you must have heard about, the ADP, how the cell works, is by glucose. So the glucose has to enter the cell, right? And this is a glucose receptor here. When it attaches to that, this will not allow to enter unless the insulin is connected to the insulin receptor. So there is an insulin receptor which will connect it, and then it will permeate the cell to open up. Now, so here you see the insulin goes in, this attaches itself, and the cell goes in. Now go to the next one. So this is a situation where our cells are full of glucose, right? There's no space. Then the insulin will be attaching itself, but there is so much inside that it will not be allowed inside.
Yeah.
So where will it go?
Excess.
So the insulin becomes lipogenic. If there's too much of glucose in the circulating blood, the insulin will convert that glucose into fat.
Ah, got it. So now the extra is here.
You just got too much
That
of
extra
it.
will go somewhere. Where will it accumulate? Fat cells. Where are your fat cells located? So the
in your belly,
easiest part of the fat to accumulate is your abdomen. Because it's lax.
Correct.
A lot of mental fat. So when you accumulate fat in the omentum, which is the covering of the intestine, you will have a belly, right? And that causes all kinds of different endocrinal imbalances. And you will accumulate fat in all very, very different places. Now, the other thing which it does is that the insulin is becoming ineffective. Right? There's a lot of insulin, but it's becoming ineffective. What is that? That is insulin resistance. And that is diabetes. So when you get the insulin, the first occurrence of insulin resistance is the insulin is becoming useless. The cells are not requiring insulin, but you are pushing glucose. Pancreas is secreting more and more insulin. And if you start doing that from the baby, say 2 years of age, by the time you're 40, all the stores of the pancreatic cells are gone. You get diabetes. So the diabetes is caused by overutilization of insulin, insulin not being effective. That is what you call as insulin resistance. Insulin resistance is type 2 diabetes. And what will it do? Central obesity, visceral fat, fatty liver. And this higher level of circulating glucose connects with or combines with the circulating protein to result in something called glycated protein. That glycated protein initiates the process of atherosclerosis. So the plaques start forming everywhere. And then, of course, you have small LDL, which is very rich in cholesterol. Then you have endothelial dysfunction. The bottom line is the endothelial dysfunction. You know, the lining of the cells, which is inside. Let me see. So this is this is the lining of the cell here. This is a normal cell. This inner lining is called endothelium. This is this is the vessel through which the blood is flowing. When you eat, what happens to your food? The food goes into your intestine, is broken into the simplest form, gets absorbed, and then it gets picked up by the portal circulation. Most of it will be circulated to wherever it's needed. A lot of it will get stored in the liver, right? Especially sugar. The sugar, then the fat, the amount of glucose in the liver will go up. That will cause injury. The glucose is very, very toxic substance if it is in abundance. That glucose will start producing accumulation of fat there because cells of the liver are also full, because in liver, the glucose gets stored as glycogen, right? But the glycogen stores are also full. Now your glucose is nowhere to go, so it will convert fat. That's how the fatty liver.
Yeah.
That fatty liver leads to damage to the liver cells and ultimately is the most important cause of today's world of non-alcoholic cirrhosis
Yeah.
and liver transplant. Now this lining, which is the inside, is your connection with the interior of the cell and outer of the cell, because here all the glucose. And if this lining get damaged, there is movement of cells inside to create this plaque. You see this plaque?
Yeah.
This is the block.
Yeah, so it's thinning, right? That
No,
whole
the
line is-
lumen has become thin,
Yeah,
and this is the accumulated plaque.
exactly.
Now, you see it now. We can see this plaque. This is a normal artery. This is inside the cell. We have done something called OCT. So we go inside the cell and we see something called optical coherence tomography. We can see all these things. So this is the plaque. You see this narrowing? This is the plaque. The inner lining, this is a normal artery like this. But this is the plaque, and you see the plaque here.
Yeah.
This is the plaque.
Oh yeah.
And when this plaque ruptures, it blocks the artery. This is a ruptured plaque. You can see the ruptured plaque.
Yeah, it's
Understood.
Now, if you are a person who has a vulnerability to rupture a plaque, and you go to a gym, and you lift 50 kg weight, you rupture the artery now, plaque rupture, you suffer a heart attack. There in the gym, you have asked the question, why gym death? And this blockage will produce something called ventricular fibrillation.
Yeah.
Ventricular tachycardia, ventricular fibrillation. Unless you shock that patient, he will not come out.
So, if you're in this situation,
You can change things.
yeah, but
First of all, you should not allow it to come.
correct. But if you're already here
So
and you hit the gym, that's what you said.
that's
right?
not for everybody.
Not for everyone.
Not
correct.
everybody.
it's risky.
Yeah.
So it's
It's a
risky
factor.
for those people who have a vulnerability to rupture the plaque. I'll tell you how.
Yeah.
Very interesting. So this inner lining of the cell, you see this lining,
Yes.
is called endothelium. So it is thinner here, thicker here. So it has got variable thickness at various places. And with the movement of the heart, it's moving all the time. So there is a shear strain going on. So the junction which will break will be this junction here. And where it will break? You increase the blood pressure. So people who have the inner lining, which is thickness is from 60 to 90 microns, which we call as TCFA, thin cap fibroatheroma. That lining, thin cap TCFA, is a precursor of a possibility of a ruptured plaque. A person who smokes, person whose cholesterol is very, very high, he eats all kinds of shit food, which I call it shit food.
Yeah.
Of course.
Of course. With you.
And then he has gone to a party and he's now binged himself and he has a fight with somebody. Or he has a vulnerability to rupture a plaque because his plaque content are soft. It's not a hard plaque. You'll be surprised to know a hard plaque don't rupture.
Won't rupture.
How do you make the plaque hard? By reducing your cholesterol, by reducing the size.
Okay.
So usually you will see an artery which will be like this. I'll show you. So this is a normal artery, this is a plaqued artery, and this is a plaque here. You see the plaque?
On top.
It may have oil inside it, oil-like material, which is soft. Now, if I make this plaque hard or I change the contour of this intimal lining, which is the inner lining, to become harder, it will not rupture. So what does lifestyle modification do? It stabilizes the plaque.
Oh.
So if you're a vulnerable person, central obesity, visceral fat, propensity to rupture where the thickness is small of the inner lining, and you go and do something which is very strenuous, you will rupture the plaque.
It'll rupture.
And that is what happens in gyms.
Okay.
And the gym instructor doesn't know it.
Of course.
Yeah.
He's got no idea about these things. So what do you need? you need that before you hit the gym. You should be able to quantify that what would be the risk of this person if I do this kind of exercise. So as a part of a health assessment, and who has a rupture, for example, there will be a question that why people die in gym and why that 30-year-old person is dying, because they all have this
soft plaque.
There is always a plaque. There has to be a reason for them to die, otherwise they will not die. There has to be disease in them. They may look outside very good and healthy, but inside they're not.
And this will happen to anybody, right? It's
can
not,
happen.
again,
Divided,
it can happen. Yeah.
provided you have certain risk factors. So we go into the risk factors now. But what are the risk factors of heart disease? Being a male is risky.
Being a male is risky.
Risky, because male more have heart disease. The ladies are protected naturally till they menstruate.
Yeah.
But working ladies are not.
Because of the stress.
Because of work stress, because they get more diabetes also. So working professionals get more diabetes. Women. All males like us, say 40 years ago, 50 years ago in this country, they will eat carbohydrate-rich diet. It's not that they were not eating. They were all eating parathas and same thing.
Right.
But they will walk. They will walk,
one
go
place
to work,
another.
And they will not have the second meal because there was no availability of food unless they come home. So there's fasting going on.
Yeah.
Now all that 5 meals, I told you, you're eating 5 to 6 meals. Every time there is a sugar. So we have introduced stuff which is rich in carbs, rich in simple sugars. We have introduced stuff which is rich in free radicals, which cause endothelial damage.
It's your coffee.
Yeah, thanks. No, I don't.
Not the best time to ask.
Absolutely
we need
not.
to put this in the reel.
That's very smart.
It'll be cute.
No, I don't eat sugar. For the last 15 years, I don't eat sugar.
Last 15 years, no sugar.
But
That's why
no sugar, no
that's why you
rice.
look so handsome.
No sugar, no rice.
That's why the skin
No
is
chapati.
glowing.
Yeah.
But I do yoga.
That's fantastic.
Yeah, I do a lot of yoga, and I do we can probably deviate from our discussion, but the health is physical, social, and mental well-being.
100%.
Yeah.
Who's your boss in the body?
Yeah.
Yes.
Right on top.
Right on top. So if that right on top is not right,
then everything goes wrong.
everything goes wrong. And to even change your lifestyle, what do you need? Control of this.
Yeah.
Exactly.
Commitment,
we were talking
discipline,
about mindful,
food, controlling the mind. That requires stabilizing the mind. That requires stabilizing the kind of flickeriness of the mind we have. Vivekananda used this term very effectively. He used to say the mind is like a monkey who has drunk the wine and bitten by a scorpion.
Bitten by a scorpion.
The mind is like that. So how do you quieten the mind? By reducing the input to the mind.
Yeah.
And that is what you call as mindfulness, stabilization, meditation.
Yeah.
When you go into that area, and I think yoga does it very naturally to you. When you go into those yogic postures or any exercise, when you commit yourself that I have to do this exercise in this manner, and I'm sure people teach you wrong exercises also. It's not that people damage your body, but that's where the importance of a good trainer comes.
Yeah.
Good facility of exercise, gym comes. It's not, gyms are not bad, but the problem is that the gym instructor has got no idea.
True.
And I see these gym instructors bulged up people with a punch. What kind of, he will all have vulnerable plaque, I can tell you.
Exactly. Correct.
Because when they exercise, they have to eat more. And what's their food? Do they eat vegetables? Do they plant-based diet? No, it's mostly curried meat.
Yeah.
So what do you eat with meat? Do you eat meat? Rice, chapati?
Predominantly. Yes.
So in a he says non-vegetarian, does he eat meat? The content of the meat is very, very low. It's mostly just chapati and rice. Chapati and heap of rice.
Indian plate.
So
No, but doctor, this whole thing you mentioned about, male versus female, I think we should we can talk a little bit more about. Yeah.
Ask questions. Yeah.
Yeah. So you were saying that how first being male, you are
So
predisposed.
male
Then
have a genetic predisposition where the nature has not protected them against producing a child, right? You have to be protected, but the progeny has to continue. See, nature, cosmos is wanting to protect preservation of a race. How does it do it? Protecting the female so that she
of
can
course,
bear the
she
child.
can keep, yeah.
What happens when you change that? PCOD. When you change your lifestyle, what happens? You don't menstruate. What does no menstruation mean? No ovulation.
No ovulation.
No ovulation means you will be infertile.
No child.
No child.
Yeah, bearing capacity.
Childbearing capacity. All the diseases will come. You call it PCOD is a lifestyle disease. They all see, if you see a PCOD girl, I mean, I'm not trying to criticize a female gender here, but then all be obese, central obesity.
Yeah.
They've got a lot of weight on them. And they will say, I don't have periods. I missed period 3 months. No, when we used to be students, if somebody misses the period, the only cause was pregnancy.
Yes. I agree with you, doctor, because I remember my mom my mom checking on me month on month as long as I lived with her, right? Which is, of course, up until marriage. But then my mother taught me the importance of ensuring that you have a perfect cycle.
Absolutely.
And a painless period. And what a painful period and no perfect cycle meant for your eventually infertility, like you said, PCOS, infertility, childbearing.
But the reality is, I mean, today women have to go out and work.
That's
no,
what
I'm not saying don't work. I'm
yeah.
not saying. So you need to be as natural as the cosmos has allowed you to be natural.
Yeah. So I'm just asking for like a solution for
what do we do as a solution?
What can they do? Like those 3-4 things that
I
they
think
can
the
do
most
now.
important thing is body fitness, physical fitness, food, and reduce the stress on mind. Sleep well.
Yeah.
These are the important.
Yeah, I think just being able to control the stressors.
If you look at why people not sleep, tell me the reason why you don't sleep. Because your
mind is
active.
racing.
Racing all the time.
You don't know how to shut it.
Yeah. You want to park the car while you are at 100 kilometers an hour.
Yeah, you cannot.
Exactly.
You cannot. So I recommend my patients, they say, sir, neend nahi aata mujhko. Obviously, there must be some stress. So what is the stress? And they will tell you the stress. One good method is that before you go to sleep and while you're lying on the bed, you think about the stresses you have. Okay, I have this worry that tomorrow I have to do this job, that job. This is not done, that is not done. For a person who's probably, say, busy with work, you plan them that, okay, I will do this tomorrow and do this day after tomorrow. So it's called as completing with your work, yourself. You say, okay, I have now a plan in my mind that I will do these things in this way.
I agree.
Like a brain dump.
Yeah.
Just like
so then you say, okay, I've worked it out.
Correct.
Yeah, your brain is not as cluttered anymore.
It's not cluttered because it has decided to do this thing. The inability to sort out the conflicts in your mind leads to lack of sleep.
Yeah. And once you do that, once you write all of that down, or at least just tell yourself mentally, you will realize that nothing that was bothering you was a big deal.
Oh, very big deal. Yeah.
No, you know what? When I was doing my menopause course, doctor, everything you said is making so much sense to me. A lot of women after menopause also are susceptible to heart disease, right?
It increases.
And then I also in the course it spoke about how, because now we don't need to bear children anymore. A lot of that phase is over. Of course, we are around to take care of the children and grandchildren, but also because that ability is now, that need is kind of over. Yeah. I mean, I don't know, you can correct me if I'm wrong. This is what I
No, absolutely right. But the nature has now taken away so your estrogen has changed, cycle has changed.
Yeah.
The body is no more producing estrogens. We are going into a phase where cellular structure is changing.
True.
And it is now becoming almost equal to any other, for example, the opposite gender in terms of the susceptibility.
Yes.
And if you don't look after yourself at that time, even worse. Because now you're more prone to it. But ultimately, it will again lead to food, physical structure, and mind. So this is what makes you see in our Shastra, they call it the 5 koshas are there, called Annamaya Kosha, Pranamaya Kosha, Manomaya Kosha, then you have the Vijnanamaya Kosha and Anandamaya Kosha. What is the Annamaya Kosha? Annamaya Kosha is nothing but food, right? The food has different parts. Food has a subtle part, which is subtle energies of the food, and food is a gross part. Whatever is gross is useless, comes out. You imbibe the food which is needed for you. Then the food decides the energy of the body, the pranic part. That what would be the energy of an organ which is damaged, be depleted.
Correct.
Right? Then that will result in a mind which is not, and the mind will decide whether I'm going to eat this food or not. If you have decided I'm going to change my lifestyle now, what do? The mind makes a decision, I'm not going to eat this. Whose decision is? The mind's decision. You take away carbs from your diet, you exercise, you don't eat. You're committed to getting up at a certain time, going for exercise and saying, I'm not going to sleep today. Most of the people that start exercise, 3 weeks, less than 3 weeks, they're gone. They don't come back. What is your drop rate of people who start exercise? It will be at least 50%, I would say. I'm sure in your organization where you work, cult or whatever you call it, there would be a lot of people who are registered, but they didn't never come for exercise.
Oh yeah, the fitness industry, I mean,
retention is not very high.
People sign up and
I think the signing up will be the maximum in the first 2
Beginning
weeks
of
of
the
January.
Yeah.
And
First
then
month,
they'll leave
yeah.
because the commitment is not there. So the commitment can only happen when you have decided that I'm going to do it. I'm not going to take it off.
The intent is
That requires the intent, that requires discipline, that requires some commitment, that requires to leave that bed and get out of it.
Yeah.
Or do that every day regularly without fail. And that changes your body.
Yeah.
The body changes, the body's energy changes. Right? Mind decided to change the body energy by commitment, change the food, change the energy of the body, because the organ which is healthy has a different energy.
Absolutely, yeah.
And then
Energy.
of course you remove the clutter from your head by going into a certain direction which is of a certain nature, where you avoid certain deviations of the mind, which is basically hatred to others and other things. That is a different topic. I don't think we need to talk on that. We're talking something else right now.
So doctor, just for everyone else to, now know more about, what do you think are like some of the earliest signs that one should not dismiss, that one should probably pay more attention to? Because there will be some signs. Sometimes
there's
it's
always
just lifestyle.
sign.
Yeah,
there is always a sign.
Yeah. So
as far as heart is concerned, or the disease of the heart is concerned, it will always give you warning. It will be very unlikely you die suddenly without having a warning.
Okay.
And most of the time in our country, people ignore symptoms of gas as heart.
Correct. That's what most people say.
Yeah.
If they feel some burn.
So they feel burning in the chest and they feel the gas. There is no way a gas can enter your chest. Gas has to be in the tummy area, right? So the most common symptom of patients who have probably, one is that they, out of blue, they suffer a heart attack. When they have disease, they don't know about it.
Yeah.
Right? That's one. And that's not uncommon. The second is that they will feel some symptoms of, say, compression in the chest or gas-like sensation in the chest. And they want to do burp.
Yeah.
That's just a false notion that it will release. It doesn't release.
Yeah.
Because, many times we have had some upset stomach. When we burp out, we feel better. So that's a preconceived understanding. Unfortunately, our diet always been rich in spices and rich in masalas. So we form more gas. Yeah, I mean, don't want to make it dirty, but then we fart much more than any other person. You have all felt it. I have felt it. I stopped eating curried food, and when I started doing yoga, there's a natural change in your perception about food. You can't eat very pungent food now. You just eat very simple food.
Yeah.
So when you eat simple food, the bacteria, the gut is changing.
It's
basically the gut, which is your second brain. The gut now will not allow the disease aspect of the body to be assimilated into the body, because the gut has become healthier. You have to somehow make your gut healthy
And happy.
and happy. That will change only with food, right? So when you are changing your dietary habits, you are making the body better, and you are now reducing the possibility of getting into a position where the disease will not come for a long time. You're postponing the occurrence of the disease. And that is what. But I forgot your first, what was your question?
Earliest warning
symptoms.
signs. Warning signs that one should not
So
dismiss.
one sensation is that you may feel a bit of a gas-like sensation.
Yeah.
It may come on exertion or may not come. It may come at the rest also. And if you feel that sensation come very often when you climb stairs, carry weight, post-meal, you become suffocated. And this has been happening now for the last 3-4 days. And people will say, I'm having some gas. So much so that people go to a doctor. And the doctor doesn't recognize these symptoms. And say, gas hai, ye Pantodec kha lo. Which is so horribly misused for gas.
Oh, yeah.
Everybody takes a Pan 40.
Yeah.
It's like a OTC, over the counter. So you should never ignore a symptom of suffocation, shortness of breath, which comes on exertion. You feel that I'm not able to now walk as quickly as I was able to because I get a bit of a compression. These are the signs of a stable coronary artery disease. And if somebody is feeling like a gas, and especially it happens in the middle of the night when you've had a party, you reached home at 2 o'clock, you have had a very heavy meal, and you get some discomfort and they say, nahi, kal jayenge. Morning we'll go to the hospital, we're not feeling well. So you should never waste that it's called the golden hour. If you reach within a certain time, if you're having a heart attack, your heart attack can be reversed. But if you don't reach within 6 hours, the muscle is damaged forever, and that will have repercussions in your life. 6 hours.
Okay.
After the initial symptom, if you don't reach a hospital within 6 hours, the muscle is permanently damaged. In our language, we call it time is muscle.
Yeah.
So if you can reach within 1 hour, you can be protected from the damage done by the heart attack. Now, what happens in a heart attack? You block an artery, which is, I can show you some pictures, which is very interesting.
Yeah.
You block an artery, so the flow stops. And when the flow stops, you will suffer a damage. For example, this is the artery here. You can see the artery. The artery will get blocked. This person has blocked this artery. This part of the heart will damage, and that's heart attack.
This one. No?
This is so the artery
The
got
dying
blocked
muscle.
here. This is the dying muscle.
There's no flow there.
There's
yeah,
no
that's
flow
why.
there. So this is the plaque. You see, this is the artery, and the plaque ruptures. The rupture plaque, which I showed you.
Yeah.
This is the plaque rupture. This is the plaque rupture.
Yeah.
This is the inside images, plaque rupture, blood clotting. You see that lead part? That's the clotted blood. So this artery is completely shut now. When it's shut, there's no flow downstream, and you suffer heart. Why do plaque rupture? This we discussed.
Yeah.
They are vulnerable to rupture.
Yeah.
The thickness of the inner lining is less, and they have a potential to rupture it if they do too much of activity. For example, somebody at 45 decides to go to a gym without investigation. He may have a vulnerable plaque, which we have not tested. And he goes and starts lifting. He's not building up his exercise. Suppose he progressively builds up exercise and he says, "Mujhe kuch chest pain hota hai," to aap as an instructor or as an owner of the gym or whatever, you tell him, go and check yourself.
Yeah.
Yes.
Correct.
Exactly.
Go and find out why you are having this.
Correct.
वो थोड़ा gas हो गया. That's a very common symptom. People say, I feel a bit of a
People
gas.
carry, Digogen and things
And they
in their bag, and they actually feel ye gas hai, and they'll just pop it in.
Yeah, which is not good. Now, when this heart ruptures, this blood clot you can dissolve by giving a medicine, or you take the patient for an emergency angioplasty and you do the angioplasty when you open the artery. So see this ruptured plaque, it's just like shattered plaque. You can see the lining is completely gone. This is a picture of a 32-year-old boy.
Ooh.
Now we have scientific evidence that what is happening inside, and you can find it out.
Yeah.
Now, of course, as I said, heart disease, high blood pressure, diabetes are the curses of the modern day life.
Yeah.
So,
So if you have symptoms of suffocation, chest compression, burning in the chest, which you have been feeling for some time, you shouldn't ignore it. Get yourself investigated,
sure.
and you will, the doctor who are looking up. The problem is that you should be able to find somebody who will not unnecessarily investigate you also,
Yeah.
which is
So
a different ball game. I'm not going to talk about.
What should they do if like it happens middle of the night? They
So
feel-
they should not, any discomfort in the chest, any gas-like sensation in the chest, any feeling of sweating and suffocation in the night, you should not wait for the morning. Go now, get an ECG done. And once you go to the hospital, they will do an ECG and they will do an enzyme test called troponin test. So if the ECG is normal, you're having discomfort, and the troponin is high, you're having a heart attack, or not heart attack, a stage prior to heart attack. That can be easily controlled.
Yeah.
Yeah.
So that's the answer for that.
So that leads me to this question now, that if people are going to the gym for the first time, and it could be at 30 years, it could be 35, 40, are there any tests, doctor? Like, of course, we do blood work, right? Like, we see the cholesterol parameters and all of that, and if it's excessively high, then we're like, please see the doctor. But just to help people now, want to work out, they want to be strong, look great, etc., and also we're in that fear of missing out era. So because my friend's going to the gym, I also want to go to the gym. I also want to push as hard. So many competitions, everyone's just participating. So my question is, are there any other type of tests that can be done for just somebody who just wants to push at the gym now?
So if somebody who has been going to a gym, say from a very young age, part of a sports participant, or does activity regularly, for him going to a gym is not a big deal.
Yes, absolutely.
He's kind of slowly just merging himself into another way of keeping fit.
Yes.
Now somebody who decides that I will become unfit, first of all, they should rule out that they don't have any pre-existing disease like hypertension and diabetes.
Yes.
If they have glucose intolerance also, they are considered to be heart patients.
Got it.
Right? If they have not glucose intolerance but diabetes manifest, is called as heart disease equivalent. So you have heart disease, unless proven otherwise.
Got it.
Your blood pressure should be normal.
Yes.
You should not be obese. You should not have central obesity. See, I can now recognize people who come to my OPD, that who has got disease and who doesn't have disease. If you have become abnormal in such a way that you have got a lot of central obesity, you've already crossed the limit of your physical being. You're abnormal now. So those people who have central obesity, they should check all their blood parameters. They should do exercise tests.
Yes.
But that's a very gross thing. Now comes your question of whether we should do a CT for these people. So suppose he has 40 years of age and you want to go to a gym.
Looks fine.
Looks fine. Doesn't look fine.
No.
But he has, for example, strong family history. There are 8 or 9 risk factors for heart disease, which you should know. One is, I said, male sex.
Yeah.
Age more than 55, but that is becoming less and less now. Say we'll call it age more than 35 now. Other countries, they call it 55. In our country, it should be 35.
And why is that? Why should it be higher in
Because we have more predisposition. We are more diabetic.
We're seeing more,
more visceral fat, and is that
BMI.
In the urban area, 40% of the general population more than 30 years, 35 years of age have impaired glucose tolerance.
That's what.
So they are now going into the direction of heart disease.
Yeah.
So,
okay.
So second is, of course, presence of diabetes is a very big important risk factor. Then smoking, most important, which is preventable. Then family history. Then, of course, hypertension and hyperlipidemia, cholesterol. And then, of course, there was a study called the Interheart study, which was done many years ago. They looked at 9 risk factors. And the most common was family history, smoking, and diabetes. Central obesity is leading to all these things.
Yeah.
If I see a 40-year or 35-year-old guy who is centrally obese, I'm not surprised he will have that impaired glucose as well as hypertension.
So I have this one case, doctor. She's my member, right, in the gym. Now of course, she does one-on-one coaching, so it's very closely observed, and we don't do. So in her blood report, her cholesterol was like off the roof, and then her CRP and all of those values also were off. So when I saw that report, for me it was a little bit of a red flag, but I'm not a doctor. So I told her, I think you should just show this to your doctor. Then I also figured, I understood that both her parents are they have heart disease. Yeah. So I said, look, you're working out, you're training safely and all of that, but there's so many things that are out of our control. So you should talk to your cardiologist, like show this report, and your parents' cardiologist, right? So then there's family history and everything is known. But then her cardiologist came back and said, no, there's nothing to worry, right? I mean, for me, that whole report looked a little, I don't know, like I was like, are you sure you should train and etc.? But then the cardiologist had given her a go ahead.
So what causes the problem in somebody who is training, for example, going to a gym, is one vulnerable plaque, which I talked about, right? It is not necessary that the vulnerable plaque should be causing very tight narrowing.
Okay.
It can be just 30%, 40%. Most commonly seen in smokers.
Yeah, she has good habits, so no.
So if, and I think that as the time passes, the gym service provider should individualize what kind of exercise you will do and what you will not do. Like we are now thinking, I feel that in the next 5 years, all treatments will become personalized. So your intent to instruct somebody should be very, very professionally done. That I will personalize, I will make sure that this person doesn't have disease. And I think sometime to rule out whether he has disease or not, you have to do a CT also. Because CT will show you.
Calcification.
Not necessary. Just the plaque will show.
Plaque, yeah.
If you don't have a plaque, your arteries are clean.
Yeah,
you're clean.
Yeah.
Go all out.
You can go all out. So even a stress test may not show. Because the stress test will become positive only in a significant narrowing.
Okay.
Yeah.
If the stress test is not positive, you may have a soft plaque.
Got it.
Which is just 30%, has a potential to rupture.
Yeah.
30%, 40%, very thin fibro. I called you, it's called TCFA. Thin cap fibroatheroma, when the endothelial lining is only 60 to 90 microns. You can measure all these things now from inside.
Wow.
And say that I'm going to change your lifestyle. You have to reduce your cholesterol. You have to exercise slowly, gradually build it up.
Progressive.
And lose your weight, and you will reverse your aging from, say, you're 30, you look 45, come back to 30. So that's what you call as changing your, regression of your age. What do you call it? Biological age or physiological age. Biological age is gone. Chronological age is 30, but you're looking like a 45. So those who are 30 or those who are 60, but they look like a 40, they're better.
Yeah.
Those who are 60, they look like a 75, they're worse because they're biologically aged. So there are now methods to look at that. Yeah. What is your VO2 max? Are you able to exercise? What is your minimum fat amount? What is your fat content of the body?
Yeah, body composition.
Do you have visceral fat or not?
Yeah.
Do you have simple obesity or not? What's your exercise capacity? What's your ability to do certain activity which you can measure?
Yeah.
And you say you are as young as a 35, even if you are 60. That person is younger. And I think the physical training should go in that direction. Yeah. That's the future. This is my idea.
Yeah.
And I think if suppose I am asked to see somebody, that find out, I am not going to leave him unless I have ruled out that he doesn't have disease, but also will tell you that where he needs correction. You understand my point? That most of the time your quadriceps and your pectorals are gone because you don't do any exercise for them. Why we become old? Can't get up, arthritis, just because our quads are gone. Glutes are gone. The core muscles are not strong enough.
Yeah.
You walk. Will the walking help you to build your core muscles?
No.
No. So you have to do some strength training, some physical conditioning of your back. I'm sure you know about it.
Yes,
The back is weak, you are weak.
Yes, posterior chain strength is.
And the posture correction. The biggest problem is people don't have proper posture. That's where the knees go. But what happens when you exercise? The body tends to go into what you call as the queue of the body, where the force transmission of walking, weight bearing is very equal on both right and left. You see, people will develop a certain posture after a certain age. That's because their body is not equally balanced.
Yeah.
They don't stand equally.
Yeah.
So these are all things which need to go into the details of changing your. Just going to the gym is not going to help. You need to look at all these things: food, nutrition, physical status, and of course later the mind. That's how it works.
But why do people, like we spoke about training and when they exert and things like that, why do people die of a heart attack in their sleep?
Yeah, so they also have some disease. See, if they are 80 years of age, they die in sleep, it's a very good death.
Yeah.
But if they're young, but you will not find many young people dying in sleep. Young people will usually die of a sudden arrhythmia which happens because of a coronary event. For example, some celebrity died suddenly. I will not take the names here. He must be having a problem which he ignored. He may be having some gas-like thing. And what people do is that they exercise more when they're not feeling well. They're trying to compensate that something is wrong with me. I will go and hit the gym today and I felt better after that. So it's not, if you are having any symptoms which are like some suffocation, some uneasiness in the chest, you should not ignore it. So if you have a vulnerable plaque, for example, but you're physically fit, your body is good, but you have a vulnerable plaque, which has given you a warning for the last 3 days, but you ignored it.
Yeah.
And you hit the gym. Then what happens is that obstruction or that damage which suddenly happens causes a ventricular arrhythmia, which is ventricular fibrillation. And such gyms which have a defib in their gym, they should defibrillate immediately. So you have to have a defib in the gym.
Yeah.
And if somebody is not, they're automated defibrillators.
Yeah.
I'm sure in most of the countries they would have a defib.
It's a mandate.
It's a mandate.
In US and things.
Because you have to be shocked. If you're shocked, see the other day, I was sitting in the OPD and there was a big ruckus which was suddenly we heard noise and somebody just collapsed. And no pulse. I was there, so we just called the defib, shocked him and he just wake up.
Oh.
In 1 minute he will wake up. And then of course do the needful, you take him to the emergency. Because if you don't defibrillate, next 3 minutes he will die.
3 minutes.
That's the cause of sudden death in gym.
We need to have defib in every single gym then. That should become.
In US you can't open a gym. Or Germany you can't open. It's not mandatory here.
Yeah. Because they don't understand. See, in any airport you see, every 100 feet there is a AICD.
Shopping malls,
AEDs, yes.
Shopping malls and airports.
But nobody knows how to use it.
Oh yeah. Even if someone's done CPR, AED course,
they don't know how to use
it. It takes guts to do that.
Yeah.
When it's time.
Yeah, I know it.
So that's the point.
So we face this kind of situation every day. For us, it is absolutely fine for somebody to arrest and we bring him out. He will not die. If he's in the hospital, he will not die. But you need to know what you need to do.
Exactly.
Yeah.
It will not be possible for a non-cardiologist to do this job.
That's the other thing.
That's the thing.
He has to have training. See, in other countries, in US, they do train common men for a CPR. Like I think when we were students, I don't know what is the condition of the US now, the Washington state, total response time of an ambulance arrival was 3 to 5 minutes.
Wow.
And almost 70% of the population. I remember my wife used to teach in a nursery. They will all train for CPR. Every 6 months, they will come and train you for CPR. ACLS or
Yeah.
ALS. There should be at least 2 people in a gym who can do this job. In our community, now they have done it. There are 3 AEDs where we live in Belize. And one is kept at the security, one is somebody's house, and there is a team of 10 people. But it is, unless you maintain the quality, it will fizzle out. Because our government doesn't provide any support for it. There is no emergency response team available.
If I didn't sleep well last night, should I have trained hard this morning?
Well,
Yeah, I don't. Maybe one of.
Yeah, I didn't sleep well last night. I
sleep.
canceled my training session.
Yeah, good. That's a good idea. So I feel that lack of sleep is always because of some stress which you're going through, which keeps your sympathomimetic drive high. Correct? You're stressed about something. When your sympathomimetic drive is high, the sympathetic system is activated, whatever reason, your norepinephrine levels are high, the epinephrine levels are high, because you're stressed. I'll tell you a simple example for that. And you need to understand that. How the parasympathetic and sympathetic system are important. And what do you do when you exercise? You actually activate your parasympathetic system. You suppress your sympathetic system. In a jungle, and this is natural, in a jungle there is a zebra. It's grazing. And there is a tiger which is going to pounce on him to kill, because that's their feed. Yeah. The tiger is now crawling. So the sympathomimetic system of the tiger is all activated to pounce and kill. So he is in flight or fright mode to kill mode. Now the zebra is grazing, but he senses and he smells and he runs to save himself. His flight and fright got activated. That means he will secrete loads of norepinephrine, epinephrine from the adrenals. Mind thought that there is a danger to my life. The natural thing is to protect. There will be increased blood pressure, increased heart rate, increased muscle activity, and he will run. He will run, and then this fellow can't chase him. Right? And the tiger says, no, this hunt is not good, stops. Zebra also runs for some time, forgets about it, start grazing. Right? His sympathomimetic system got activated and came down. What happens to humans? They don't suppress their sympathomimetic system. They're always in hot causing flight and fright. So they're always 24/7, their flight and fright is activated. So if somebody's flight and fright is activated because whatever reason today, he will not be able to sleep. And that's the cause of lack of sleep. Now he's already stressed. His sympathomimetic system, because they are the initiators of arrhythmia.
Got it.
And then you exercise, your body is not fit enough, is not rested enough. You're likely to have a complication. So I would say, if you don't sleep well, skip your exercise that day or do something very mild.
Nothing intense.
Nothing intense where you're not
heavy.
Or maybe just more relaxing, like just
go for a walk.
Yeah. Just for a simple swim.
And otherwise, just prioritize sleep. I think.
If it's consistent, then obviously
if it's consistent, then drop
the
on
other
exercise.
thing is that you should not eat very late.
Of course.
Because if you eat late, and there's a relationship between insulin secretion and the growth hormone secretion, I'm sure you know about, that if you sleep late, first of all, you eat heavy food and you sleep immediately, the growth hormone is never kicked, insulin is kicked in.
Exactly.
The growth hormone will not have a chance to
create
the homeostasis in the body. So first of all, the regeneration will not take place.
Yeah.
And you're eating all, as I call, shit food anyway.
Yeah, especially the late eating.
Late eating.
Yeah, 100%.
And then you have slept only 4 hours and you've eaten a heavy meal, your food is still not digested. You go and push yourself in a gym where the oxygen demand of the bowel is more, heart is not getting enough, and you can have a complication. Because the bowel still needs more blood to digest the food.
Yeah.
Your full stomach. So the blood is directed towards bowel for process of digestion. So if there is a lack of blood supply to the heart and you exercise, that will even become worse. And that ischemia, we call ischemia, lack of blood supply, will lead again to an arrhythmia. Because the most common cause of an arrhythmia is lack of blood to the heart. As soon as the heart doesn't get blood, it will throw an arrhythmia. So that person may have a higher chance of having an event if he has a predisposition because of a previously existing problem in his heart.
Yeah.
A normal heart may not.
React that
But
way.
if someone does it consistently over and over again, there is
Then
probably going to be
definitely.
damage.
Or maybe he become used to it.
Okay.
Possible.
Now,
What about people who work night shifts? They're going to
Very bad. Their circadian rhythm is just gone. They eat wrong food. They don't eat well, and that's not the. See, what is it normal?
it's not.
It's not normal, yeah.
Definitely not. You're working against the whole
Against
rhythm
the whole
itself.
the circadian rhythm, the exposure to light. Your body is designed. See, we're not away from the cosmos. We're part of the system. I call it the grand design. We are part of the grand design. You cannot be deviating from grand design. All those people, for the sake of money, working for US, the timings are different.
Yeah.
They wake up in the night. They sleep very less. They eat all wrong times, and they eat bad food, and they snack while working.
Yeah.
But doctor, if they manage to still get their sleep and manage to have good nutrition, they'll still be.
The quality of sleep is more important.
Yeah.
If you see, I sleep only 5 hours. Don't sleep. I sleep at 10. I wake up at 4:30.
But the quality.
The quality, because
the hours.
I don't know what is happening in between.
That's amazing.
And sometime when suppose we have to go and work in the night, I had to go in the hospital and be awake, say till 2. The next day I'll compensate. Sleep a bit extra.
Yeah. Correct. Yeah.
I think overall scheme of
Definitely.
things, if you are able to monitor and build your behaviors, like these
A
things
lot
can
can be
be.
And
controlled.
also have a good
Now I have
quality
fun.
of sleep.
Yeah.
I don't think it is necessary to sleep 8 hours.
Yeah.
Because most of the time when you're going into that REM sleep, anyway you're not sleeping.
Yeah.
It's a rapid eye movement sleep. And as you go to sleep, the REM will increase, the non-REM will come down. That is why you dream early morning, because the REM sleep is more. So yes, it is possible that if you are sleep deficient, you'll not dream. And you get
You will
to
not
sleep.
dream because you're not getting the REM.
You're not going to REM.
Okay.
You're sleeping
Correct,
most of the
correct,
time.
correct. You're sleeping most of the time. Yeah. I have one more question. Now, this is all cases that I have, which is why I'm asking you.
Sure.
Smokers. Okay. So I have cases where you smoke and then 15 minutes later you go in and train hard. Or sometimes you train hard and 15 minutes later you step out and smoke.
The most important cause of heart disease causing heart attack in young is smoking.
Okay.
The
I
worst
just needed
thing
to
you
hear
can
that.
do to your life is smoking. A completely preventable condition.
Yeah, of course.
Exactly.
So all those people who are smokers have a vulnerable plaque.
Yeah.
And you saw what happened to them.
Absolutely. And the fact that even with that habit, you have the guts to go and push yourself in the gym is what shocks me.
I don't think they're like
They
thinking about
they know
it.
about
They're
it.
not thinking.
They're not
Exactly.
even thinking
Don't know
about
about it.
Which is why I asked the question, because if
I mean,
want
they
to put this out there,
know that smoking is
Bad for
harmful you.
health,
You know, you go and
yes.
watch a movie, first thing they show is that.
Yes.
They know it's harmful, but they're still doing it. So I don't think they're thinking about the
But
negative effects.
Rishabh, I show them this plaque rupture
Yeah.
and
Exactly.
say, this is what is happening to you if you are smoking. Would they still smoke?
Vulnerable.
Some
plaque.
of them will still smoke. See, when we see a patient who comes with a heart attack smoker, 90% of them will stop smoking, but 10% will start again.
Yeah.
10% never stop, and
Never stop.
about 20 to 30% will start again over a period of time. Because they've been never told what it does to you.
Yeah.
The problem is we have no reason for us to be told that what is bad in this food, what is bad in smoking, what is bad in alcohol, for example, binging. They all produce problem. And with alcohol, people smoke more. I'm sure you were going to ask a question on alcohol.
Yeah, of course. I
Yeah,
had
he was
because
going- he was going to
I was going to ask that at some point people believed, and there are so many out there who still believe that alcohol in small amounts is good for the heart.
Like red wine, you said.
Yeah, like red wine.
Yeah, it's still true.
Oh, wow.
But recently there's a publications coming that alcohol is responsible. Alcohol is a carcinogenic.
Yeah.
I mean, bit of inhibition, lack of inhibition. What alcohol does is it removes your inhibition and you feel a bit happy, right? So I don't drink. I used to drink, by the way. But over a period of time, I have stopped drinking. I think if somebody takes social small amount of drinking, it is not so harmful. And in that Interheart study, alcohol was not directly related to causing heart disease. It was indirectly related, which meant that people who drank, ate bad food and smoked.
Yeah.
And
All
that's
that.
what it was related. So small amount of alcohol, maybe not bad, but you should not binge how much you can drink. And if you keep drinking.
I just assume that permissible limit is so ridiculously low that people don't want
to drink.
They don't want to hear that
I
advice.
agree with you. That doesn't give them anything.
Yeah,
That is true.
exactly.
That makes
That's
complete
true.
sense.
Yeah.
That's true.
So we keep hearing about how eating pomegranate can help you clean your plaque. I want to know how much truth there is to that.
I think all these...
No, pomegranate in particular, doctor.
No, I don't know this answer, by the way. But I don't think anything... Suppose you imagine somebody. Central obesity, visceral fat, fatty liver,
Eat
cholesterol
pomegranate.
200, cholesterol LDL 200. What will poor pomegranate do?
Exactly.
You need to control everything. And eating pomegranate is probably going to give you some free radicals. It contains free radicals, which are responsible for scavenging the free radicals.
Yeah, I think focus on reducing
the scavenger. So you can add to your food, but it is not going to be one medicine for everything.
It's not going to mop it out.
Yeah, no, it's not.
I know, exactly. That's what I wanted to check.
It's not going to mop it out,
We've
for
heard
sure.
of this.
Yes.
What are some of the tests, lab markers that people can proactively look at specifically for heart health?
One, of course, is that your sugar levels should be normal, or you should not be a diabetic. Your lipid levels have to be low, especially the LDL cholesterol. And most of the time we find that LDL levels are very high and HDL is low.
Yeah.
And of course, as an Indian whose diet is very rich in what you call as the non-HDL cholesterol, which includes triglycerides, VLDL and everything, they're also quite high. And when we see uncontrolled diabetes, we'll see a very high triglyceride, which is an important risk factor for heart disease. So we should look at their lipid levels, we should look at their exercise capacity, we should look at their... And I think now I rely more and more on what kind of... So if you just do a plain simple CT also, you will see the amount of fat they have. So if they are obese centrally, visceral fat, they don't exercise, their cholesterol is high, their glucose tolerance is becoming impaired, the HbA1c is going around 7, 6.8, 6.6, they have a family history, the blood pressure is going up, then they are the people who should be careful. And maybe these would be the intermediate risk, and I would do a CT to make sure that their arteries are clean. And then guide them to change their lifestyle so that they come back to the normalcy about other things.
So CT scan, people don't proactively have to do. If some of these things are out of the whack.
Well, I think suppose that gentleman you said somebody died in the family and we had a CT on him. We knew that he has disease. So we have started doing CT more and more now for us to rule out disease. So suppose somebody comes to my office, he's 40 years of age, he said, tell me doctor, do I have heart disease? I do all other tests, but I can't prove he doesn't have a doesn't have a plaque.
Yeah.
How do I prove that he has no plaque?
Yeah, you'll have to see it,
You have to see the plaque.
Exactly.
So
only a CT can.
Only CT can.
Exactly.
And it's very safe.
So it's good to test.
It's good to test. There's nothing wrong in it. But it should be under the guidance of a doctor.
Of course.
Of course, yes.
Of course. Yeah, because this gentleman who passed away, the 39-year-old, he loves going to the gym, trains a lot. But clearly his waist was bigger than his chest. So, this was like probably bound to happen at some point.
You are part of a profession where you look at train people for their physical fitness, and you as well.
Yeah.
I'm sure by looking at it, you can tell them.
You can tell that,
Yeah.
It will not take much time for you. I can tell who's not good and what's their lifestyle.
Yeah.
Whether they exercise or not. You can see the body.
Exactly.
Right? By looking at it, you can tell that they are fit. Now, also is a problem that fitness is not a proof that your inside is okay.
Exactly.
And hence testing, I think that's
hence testing.
Yeah, hence testing, yeah.
Not like whether or not you are fit. I think testing should be mandatory.
Absolutely. People, fasting is a very interesting concept now.
Yeah.
Everybody knows about intermittent fasting. And I think it works. Of course, there are newer and newer agents which are coming now to reverse your diabetes. There's GLT-2 inhibitors, the GLP agonist, what you call as Manjaro and the Ozempic.
Yeah.
They're helping people. We don't know what is the long-term effect at this moment. But I think they may be a good agent to initiate the loss and then sustain. But without lifestyle modification, these agents will be no good.
Exactly.
It has to be aided with lifestyle modification. So that's where intermittent fasting will work.
Yeah.
How you prevent heart disease? This is a question. First of all, if you have some concern about it, get yourself examined. But how do you make sure that you don't get heart disease? You have to work from a very early age in life. For example, I will recommend your baby, don't give her sugars now.
No refined sugar.
No refined sugar.
And what about like jaggery and
Same.
Yeah, jaggery is also refined. Yeah.
Same.
Wow.
So if you take away that from your diet, then you would be like your son. But because the addiction to eating sugar is worse than marijuana.
That is true.
You have the craving to eat carbs. And I'm not saying don't eat as a food. Most of us who know have cut down our carbs.
Yeah.
I'm sure you don't eat much carbs.
Yeah. It's mainly whatever supports my training.
That's it.
Yes. How much ever I need to support my training.
Yeah. Otherwise, I don't eat carbs. And if you go somewhere and people are offering you some food which has got carbs, I'm going to make a fuss about it. I'm going to eat it. And I'm not going to show that I don't eat it. Although in my house, whenever there is a dinner and people start talking about what you're talking, people don't eat. Because I talk about all these things. Yeah.
Is egg yolk healthy and unhealthy for the heart?
Well, I think the permissible, consumption is about 2 yellow eggs per week. Two yellow eggs per week. But you can eat white as much as you want.
I've been eating one a day.
Of yellow.
Yeah.
Actually, if your cholesterol is low and your risk of heart disease is low, then you can eat. There's nothing wrong with it. It has got certain advantages also. It's not that it's completely. But if your cholesterol is well controlled, you don't have heart disease, you're proven that your cholesterol is under control, your family history is not there, you're fit, you can eat. I actually sometimes recommend to lose weight, to eat more protein, of course.
Yeah.
And I said eat 4 eggs per day, but only twice or thrice yellow also. One egg, but it will be all albumin.
Got it.
Albumin will increase your, so your requirement is 1 gram per kg body weight. As a physical trainer, you require 1.1 gram per day. So if you're a 70 kg man, where is the 70 gram going to come from? We don't have that kind of a food. 1 egg gives you 6 grams of protein.
Oh,
albumin.
6. Okay.
6. The content of dal is 18% of this weight in protein.
Let's talk about cholesterol. What worries you more? Is it low HDL or high LDL?
The first is always the high LDL.
That should worry us
As
more.
a physician, the high LDL is a problem because LDL, oxidized circulating small LDL, it's called as the small LDL, is the problem. That is the one which goes inside the cells. So, I talked about this lining of the cell inside the vascular tree. So when you have endothelial damage, which is caused by risk factors for heart disease like smoking, endothelial is nothing but a pavement of tiles like these tiles, right? One tile has come out, so water will seep in. So the LDL goes in between these cells to go inside the wall of the cell. And when the LDL goes, the cells will come to heal that area. They want to throw it out. So the small LDL, which is oxidized, rich, because whatever is circulating in your... See, cholesterol is nothing but a carrier of fat, right? cholesterol job is to carry fat from one place to another for it to be used by the body or deposit for the maintenance of the structure, shape, or use when the fat is not required. For example, it's the energy, you're storing the energy. So the LDL, which is oxidized, can, so there are gap junctions between the two cells. There's small spaces, like crevices. It enters. Once it enters the wall, and I can show you some diagrams, the wall structure, the smooth muscle cells which are sitting there, they're going to scavenge it. They're going to throw it out. So what they do is the white blood cells will migrate towards that and try to engulf that. There's a lot of LDL. So first of all, what is the cause? Damage, endothelial dysfunction. Endothelial dysfunction is that your lining, your wall is bad, and endothelial dysfunction is caused by diabetes, smoking, hypertension, and of course, when that happens, the LDL will become toxic free. So LDL cholesterol is the first target.
Okay.
In patients who have heart disease, who have at least 3 risk factors, we want to bring it down to less than 55 now.
LDL.
Next target is HDL. Now the problem is that when you reduce the LDL, HDL also comes down. And there's no drug which is designed as yet to increase HDL. There was a drug, I think the drug's name was tositrapib, which came many years ago, 20 years ago. But it led to more strokes and was discontinued. But there are drugs coming which will increase the HDL. Now, how will HDL increase? Exercise. Nuts, small amount of nuts and seeds. Nuts and exercise. Some people say HDL free fraction will increase by drinking alcohol also, but we don't recommend. But basically, it's exercise, fitness, less consumption of fat and oil, and of course the plant origin of fat. Like that's why you say avocados are good. Because they contain the HDL increasing tendency, and they have the omega-3 and omega-6 fatty acids. Yeah. And of course the planktons which the small crustaceans eat and see. See why seafood, like Japanese eat a lot of seafood, weed also.
Yeah, seaweed.
That contains omega-3, Icosa, pentaenoic acid, and docosa, hexanoic acid, which is good for you. This scavenges the bad cholesterol. So HDL is something which takes away the cholesterol from your body, and LDL is which is circulating, which is all of us have a lot of LDL. So when so in treatment, the first target is always LDL, and then we look at triglycerides. And HDL, we don't have any drug to increase right now. So we will say, okay, exercise, take some nuts. And if the LDL has fallen too much, I tend to reduce the statins now. Let the HDL come up.
So if the LDL is going down,
LDL has gone too much down, and I don't need that. Somebody's LDL 34.
You just need it under 55.
55, but so the guidelines were initially, and we sometimes don't even understand how these guidelines are created. What is the background? What is the conspiracy behind that? That is a different question. But initially we used to say 90, then we came to 70. Now we say 55. And HDL, I mean, for example, my LDL was quite high, but my HDL was 65. But I take a drug. I take a statin. Because my LDL was 148. It was quite high.
Is that genetic?
And after a certain age, the metabolism is like that.
Slower.
But we have seen patients and ourselves, and I'm pretty sure you can see yourself, that when you go towards fitness, diet modification, everything falls.
Everything falls. So true.
You're born with LDL of 55. All animals are LDL 55. As soon as you go toward adulthood, start rising. I have a diagram for that.
Wow. Interesting.
So animals kingdom, which you are also part, when you're born, LDL is less than 50. Starts going up. May have that. I think I've removed that slide. No, I don't have it. So, in the spectrum, you are donkeys, horses, dogs which are not domesticated. Domesticated dog also have heart disease because they eat carbs. You've given carbs. They all get diabetes now. I'm not joking.
Oh my God, I love
And
this.
they are given biscuits to eat,
Oh, yes.
which is very bad for the animal. Animals are not designed to. The domesticated dog has diabetes. I know a friend of mine, 2 dogs, both have retinopathy because of diabetes. They were blind.
Ooh. Wow.
Yeah.
So everything is explainable.
What about hypertension, doctor?
So hypertension is the most. So when you have a damaged endothelium, right, and a vulnerable plaque, what would hypertension do? Hypertension is the force by which the blood is hitting that plaque.
Oh.
I'll give you a story.
The force.
Force.
So
if there is a weakness of certain point of the plaque,
okay,
a sudden increase in blood pressure will do what? It'll break it.
Yeah.
It'll break it.
Correct.
The plaque will rupture. So hypertension damages your eyes, damages your heart, damages your kidney. Because it's the sheer stress force. And what is hypertension? Hypertension is the force by which the heart is pumping blood. And I have a theory which I have not sort of read or could have deducted, that hypertension is nothing but a resistance offered to the heart, right? So when you have vessels which are what you call arterial, so you have large vessels, as you go towards the smaller arms and the vessels become smaller. So we have large arteries and medium-sized arteries. The medium-sized arteries have muscle in it, right? Now suppose your endothelium is damaged. Damaged endothelium will require healing. So the smooth muscle cells will produce collagen to heal the damage and produce some kind of repair. So whenever the collagen will come, the elasticity will come down. The tubes will become more rigid. If you're pumping blood through a rigid tube, the blood pressure has to be higher. If it's not pulsatile, so when we become rigid, which we become over a period, the aging is nothing but increasing rigidity. When the vessels become rigid, the heart has to pump against the resistance. The R goes up, against which the heart has to pump. So the heart has to push, otherwise the blood will not cross the vessel.
Yeah.
So hypertension is a subject again caused by endothelial dysfunction, increased vascular resistance, for which the heart has to pump. And at some part of the body, that increased pressure is not good, like kidneys, like eyes, the brain. So if you have gone, and most of such people who have hypertension are obese. Everything in today's world is going toward weight.
Yeah. I'm just
Reduce weight. Now, whether you want to go to gym or you want to do exercise, you want to take your food, I would say do all.
Yeah, of course.
Yeah.
Sleep.
So my blood pressure started going when I was 35.
Wow.
I think that's also because of your job. That's like,
Then I started doing yoga and I changed my diet. My blood pressure is
wow.
110. I don't take a drug.
Wow.
Came down.
so you had hypertension, and then with exercise.
With weight reduction, because I was
reduction,
about 670 at a certain time. Now I'm 65, 66, 64. That's 5 kg weight reduction with no central obesity.
Yeah. Most importantly.
The most important. And change in diet. So I don't eat as far as possible processed food. Nothing. No sugars.
Yeah.
I think I need to also stop sugar. God.
Processing.
Yeah.
Just make sure that the food is not processed. And my blood pressure is now 110, 70. I mean, my heart rate is also, of course, your heart rate must be around 55, 60.
Yeah.
Like resting
Same
heart
as
rate?
mine. Resting heart rate. Mine is 650.
43.
Yeah,
40,
mine is about
50 is my 50.
Damn good, doctor.
Yeah.
50.
So
Yeah, mine
that is where the
47.
heart rate variability comes.
Yeah, so that was going to bring us to our next question.
Yeah.
I mean, last question. All of us are wearing a wearable, a smartwatch, and etc. And most of us now start tracking our resting heart rate, our sleep data, heart rate variability, VO2 max, everything. So please help us understand a little more about heart rate variability.
Lack of heart rate variability is a sign of disease.
Lack of
heart rate variability is a sign of disease. Heart rate variability means that when you need the heart rate to go up, it goes up.
Yeah.
When you don't need it, it comes down. This is heart rate variability.
Yes.
Right?
Yes.
Now, somebody who's unfit, obese, weight 110 kg, height, body mass index 35. If he walks or runs, what will have the heart rate go? It'll suddenly
go
climb.
off the roof. Yeah.
And when he will rest, it will take a lot of time to
Come down
back. And that is lack of heart rate variability.
Yeah.
So heart rate variability is a bit of a paradox. And such people who are not fit enough, they don't have that heart rate variability, their resting heart rate will be high.
High, correct.
Because their flight and fright is always activated, whatever reason. They're stressed, the body is unfit, the body requires more. See, what happens to the heart when the heart has to pump to 110 kg versus a 50 kg?
Yes.
He's doing more work.
Correct.
So what will be the lifespan of that person? Will come down. Shorter. So heart rate variability is a sign of, and if their parasympathetic tone is low, what do you do by doing exercise, yoga, fitness? You increase the parasympathetic tone. Nature has made this vagus nerve to come from brain to go to your pelvis. Why? Why nature designed a central cranial nerve to go to pelvis? All over the body there are vagal fibers. You eat controlled food, you exercise, you keep your body fit, your heart rate will be low. If your heart rate is low, you're fit. If your heart rate is not low, then means your heart is just spending more time. The same, they say the respiratory rate and the heart rates are fixed for a human being. Obviously, if you're beating 60 beats per minute for 30 years, the heart is doing less work. And that heart is relaxed. When the heart is not relaxed, the heart has to pump more. So the maintenance of the cardiac output is a function of heart rate multiplied by cardiac stroke volume, which is how much blood heart pumps in one beat.
Yeah.
So if your body requirement is, say, 3 liters at rest, and it can do it with a good effective contraction at, say, 50 beats per minute, nothing wrong with it. But if your body is not fit, the same cardiac output which it requires, and the heart is not fit enough, the body needs more, you have to push more heart. So instead of 40, 50 or 60 heart rate, it has to beat at 110 more. So there is increased adrenergic drive, whatever reason, and lack of parasympathetic tone, lack of fitness of the body, lack of heart rates, all nerve endings of the heart is gone. So you will have resting tachycardia, and the variability will not be. So good athlete, Usain Bolt, when he was sprinting, he will pump at least 30 to 40 liter of blood per minute. So their heart is so effective. Because your body requires that.
How strong is that?
Like over so many years, how have you handled the stress? Because your job is stressful.
I think that stress becomes a kind of a reward for you. I think that's got a good stress. When your stress is there and you make somebody feel better, he goes home and he says, "Thank you very much, doctor." That stress becomes.
But there is also
burning,
the other side of it, right? Where
absolutely. I feel that I'm not burnt out as yet, but I'm trying to change my way of working, not reducing the work, but going into a different direction.
Okay. I don't think you are on social media. So if people have to reach out to you,
reach the hospital.
I think I should come on social media.
I think this should be the start.
I don't mind going into it, and I think my job is to teach some of the very professional things.
Yeah.
But also in the future, I want to teach a group of large number of people in a platform where we can teach how to change your life.
Exactly.
Amazing.
For example, your group of people, If you do, for example, every 3 months one talk,
Yeah.
help them.